And let's get more perspective on the situation in Maiduguri. The Vice President, Medical Initiative for Africa, Dr. Agbo Ebuta, joins me on the news. Good to have you join us, Dr. Ebuta.
It's good to be here. Always a pleasure.
So we've seen the state government and the federal government move in to try to quickly address the immediate needs of those who have been affected by the flood. We've seen food items and cash being given, as you know, we've been reporting, as well as some sort of temporary shelter. But in terms of what this will mean for their health, what are your concerns?
Well, my concerns are, well, first we would want to commiserate with the people, the good people of Borno, Maiduguri. Maiduguri is home to 2 million people, and you have a complete displacement of as much as 70%. That is quite a lot, 1.45 million people. This has a lot of implication because as some of these people move into temporary camps, the overcrowding has a lot of implication. You have people in a smaller space, higher risk of exposure to disease, respiratory infection, but a major impact would be on access to safe water. We need to understand that safe water would be a major pivotal point for health challenges if people cannot access safe water. Already, with so many people accessing water that may have been contaminated by the flood water, it's going to create a challenge. So we need to focus on that. In addition to that, health conditions like mosquitoes, bites, and malaria are likely to spike up. Malnutrition, acute malnutrition because of a complete devastation of available food, stored food, would disrupt the food security acutely. And I'm hoping that, yes, the state government and the federal government is rising up to the challenge, and that will be mitigated. So we expect that, especially in the under 5 population and the extreme of ages, in the elderly, they may suffer some form of acute malnutrition because these are age groups that are unable to fight and request for food. As people go into camps, we do expect that there may be a spike in gender-based violence because people are in crowded space. We do expect that there may be a spike in transmission of viral diseases like hepatitis and
HIV. And that's why, I want to come in, Dr. Ebuta, because you've talked about the spike in viral diseases, but at some point, we're a country who was, dealing with numerous infections and diseases at the same time. We're dealing with mpox, cholera, and diphtheria. I don't know the situation now, but what we know is that some people are already returning to their homes as the flood waters recede. What is the implication of that?
Well, the implication of that is that that would mean we are moving into the recovery phase. But the background of all of this is that there's absolute disruption of the health system right now. Primary healthcare centers would have been flooded. Their supplies would have been compromised. General hospitals would have been flooded, supplies would have been compromised. The human resources that support this health infrastructure too, they are also victims of this flood. So they will also be, in one way or the other, unable to resume at their various health posts. So all of this has implication. Then access to health facility due to disruptions of bridges and roads are also significant. So we do expect that there will be an acute inability to respond to emergency health services in a significant percentage of the population. So that's an area that we probably would need to look into and come up with measures and interventions that involve both national, subnational, and extra parties interventions.
And as people, in this kind of situations, where people come into makeshift camps, what should be the first thing to be done? Because I was asking you about people returning home, because if you've been crowded with anyone who has an infection or, contagious disease and you're going back home, you're definitely going to spread it. As you give them cash, you give them shelter, what is the first aid that should be given in terms, of health as well?
In those camps, for example, we need to make sure that those camps are well spacious and avoid overcrowding. We need to ensure that there's safe water in those camps. We need to deploy those machines that can clean up water and make them safe enough to drink. We need to deploy facilities that protect them from the weather, for example. We need to be able to provide food in those camps. And then when they finally begin to transit back to their various communities, we need to provide some form of support that allows them to recover, to resettle to their pre-morbid states, that the pre-flood state. This will require that they need to repair their homes, They need to get their medications. I would tell you for free that with the population of 2 million people, at least 300,000 of that population, based on estimations, are hypertensive and diabetic patients, apart from other chronic health conditions. These are people that would need their medications. Some of these medications have been destroyed by floods. So we need to massively intervene, provide some of these medications so that people with chronic health conditions and acute health conditions are addressed. In addition to that, there will also be a lot of psychological
I apologize. I understand that we do have to leave it. I know you want to make an important point, but my time is up. Thank you so much, Vice President, Medical Initiative for Africa, Dr. Agbo Ebuta. Thank you for your time.
Thank you for having me. Thank you.